Hi friend, we know that you've gotten some bad news about your health recently. It's a lot to process, and you're probably hearing a lot of new words and are being told about different decisions that need to be made. In this video, we're only going to focus on your pancreas, what it means to have cancer in your pancreas, and how that doctor can tell that you have a tumor there. You will see purple boxes with words that you might hear from your care team. If you want to take notes, you can pause this video if you need to find paper and something to write with. We also have a handout with the same information for you. Just talk to your community health worker if you'd like to have one.
Most of us don't really think about our pancreas or have even heard about it. But now it is important to learn a bit about it. The pancreas is a 6-inch long organ near your stomach. It is shaped like a flat pear and is surrounded by a whole bunch of other organs, such as the stomach, the small intestine, liver, gallbladder. Its main job is to digest your food and control your blood sugar.
Sometimes there are abnormal cells in the pancreas, and our body usually sends healthy cells to fight these abnormal cells. But when the body can no longer fight those abnormal cells, they grow out of control. They take over and become a mass or a tumor.
Some of the ways you can tell you have pancreatic cancer is that you have diarrhea, stomach pain, weight loss, and your skin and the white of your eyes become yellow. All this can be uncomfortable and affect your everyday life. So the good thing is that there are ways to manage these symptoms and help you feel better. So you want to let your doctors know how you're feeling and what exactly is bothering you, so they can do something to help you feel better.
When doctors tell you about the cancer, they usually tell you what stage the cancer is in. The stage tells you a little bit about how big the pancreatic tumor is and in which part of the body it is. It also helps your doctor figure out the best way to manage it. Stage 1 means the tumor is only in the pancreas and small enough to possibly be removed with surgery, meaning a doctor will try to cut it out, but usually you will first receive chemotherapy to shrink the tumor. Stage 2 means the tumor has spread outside of the pancreas to surrounding tissues like the intestine, but it is not in your blood vessels or hasn't spread to your lymph nodes. Your doctor may still be able to take out the tumor with surgery in this stage, but usually only after you receive chemotherapy to shrink the tumor. In stage number 3, the tumor has spread outside of the pancreas to your lymph nodes, but hasn't to other organs. Doctors usually cannot remove it once it is in that stage. In stage 4, the cancer cells have spread to other parts of the body far away from the pancreas, and at this point the tumor may not be cured by chemo, but it can be slowed down.
After your doctor has found the tumor, your doctor might ask you to get some tests done so that they can better understand your diagnosis and what are the best options to manage it. These may be blood tests or imaging tests such as X-rays, CAT scan or MRI, or a biopsy. A biopsy is a procedure where a little piece of the tumor is taken out so the experts can have a close-up look and learn more about your illness.
Your doctor would also tell you about genetic testing. Genetic testing is a medical test that looks to see if you were born with an increased risk of developing pancreatic cancer. Sometimes it can help the doctors decide which treatments to use. Doing genetic testing can also help people learn about their future risks for cancer and how they may lower their risk or how to detect it early. Genetic testing can also help your relatives understand their risk for developing this disease, since it can sometimes run in families. If your genetic testing results are abnormal, your family members should also be tested. These tests are pretty easy and can usually be done with a simple blood test or cheek swab. After it is collected, it is sent to a genetic testing lab. Test results are usually available 2 to 6 weeks later.
We hope this video helps you and your family understand what it means to have cancer in the pancreas, what you can expect, and what it might look like to manage your symptoms. You can always come back to this video and look at your handout we gave you. In the next video, we'll talk about some of the treatments and management options that you may be asked to consider using. But for now, take a deep breath and sometimes to process all this new information and tell someone about what you learned.